Hi there, I'm Caleb Wise. I'm a assistant professor of clinical psychiatry within the psychiatry and psychology department at UEComp. I am a physician by training and do most of my teaching through clinical work with residents and medical students. I teach M1 students during their Block 6 lecture series and do a handful of the psychiatric lectures that they do during that block. I also do lectures for psychopharmacology and psychosis for the M3 and M4 students. In order to promote critical thinking, problem solving with my learners, a lot of the times it's within throwing them within clinical settings, whether it be in the inpatient unit, in the outpatient unit. It's a lot of times it's with just looking at presenting the idea of doing the clinical interviews with patients and trying to promote looking at them at as a whole person rather than just within just psychiatric terms as well, just because so that we are making sure we're not just missing out on other physical health issues that could be contributing to underlying psychiatric problems as well, and using that framework in order to how to better approach their treatment, both in the hospital and looking for discharge as well as in the outpatient setting, so that we can hopefully treat them as a whole person that will then influence their psychiatric care. A typical scenario where I'll help guide a learner, whether it be a medical student or a resident, in using their critical thinking is usually within patient encounters, whether it be on the inpatient side of things or outpatient. Usually in that situation, I'm usually teaching them how you chart review a person in order to kind of look at the scenario of the information that's presented to you, both in the current encounter as well as historically within chart review, and being able to kind of look through things in a way of how their differential would look just off the information that's given to us by other providers, and before even diving into the actual clinical interview. And then a lot of times it's then bringing them on the inpatient side, usually is helping guide the clinical interview or modeling how that clinical interview should go before making decisions based off of the information we gathered, how to go about their treatment. In the outpatient setting, it's usually through supervision and then providing feedback to them after the resident has interviewed the patient in order to go through what their differential is, what they think is the most likely diagnosis and the best way to approach from usually a medication standpoint, but also integrating their ideas about therapy into it too as well.